Introduction. Optic neuritis is a condition characterized by inflammation of the optic nerve, leading to visual disturbances. It is an important clinical entity that can occur in isolation or as a manifestation of various systemic diseases. Understanding the mechanisms of inflammation in optic neuritis is crucial for accurate diagnosis and effective management. Additionally, exploring the role of genetic factors, advanced imaging techniques, and neuroimaging biomarkers can provide valuable insights into the pathophysiology and prognosis of optic neuritis. In this script, we will delve into these topics and discuss their implications in the diagnosis, treatment, and overall management of optic neuritis. Optic neuritis is primarily an immune-mediated disorder, wherein the immune system mistakenly attacks the myelin sheath surrounding the optic nerve. The interaction between T cells, particularly CD4 plus T cells, and the ocular tissue is believed to trigger the immune response. These activated T cells release pro-inflammatory cytokines and recruit other immune cells, such as macrophages and B cells, to the site of inflammation. The resulting inflammation causes demyelination and axonal damage, contributing to visual impairment. Although optic neuritis is often considered a sporadic disorder, genetic factors have been found to play a role in its pathogenesis. Genome-wide association studies have identified certain human leukocyte antigen, HLA, alleles, such as HLA-DRB1x1501, to be strongly associated with an increased risk of optic neuritis development. These genetic variations may influence immune regulation and predispose individuals to develop an exaggerated immune response against the optic nerve. Advanced imaging techniques, including optical coherence tomography, OCT, magnetic resonance imaging, MRI, and visual evoked potentials, VEP, have revolutionized the diagnosis, monitoring, and assessment of optic neuritis. OCT allows for the precise measurement of retinal nerve fiber layer thickness, which can aid in identifying subtle structural changes indicative of optic nerve damage. MRI provides valuable information about the location, extent, and characteristics of optic nerve inflammation. VEP measures the electrical activity generated by the optic nerve, providing insight into the functional integrity of the visual pathway. Neuromyelitis optica spectrum disorders, NMOSTs, are a group of demyelinating disorders that involve the optic nerves and spinal cord. NMOSTs are distinct from multiple sclerosis, MS, and have specific diagnostic criteria, including the presence of aquaporin 4 antibodies. Recognizing the distinguishing features between MOST and MS is essential, as treatment approaches and outcomes differ significantly. Differentiating optic neuritis associated with NMOSTs from idiopathic optic neuritis requires careful clinical evaluation and appropriate testing, such as aquaporin 4 antibody testing. Optic neuritis is strongly associated with multiple sclerosis, MS, with up to 50% of patients with isolated optic neuritis developing MS within 15 years. Optic neuritis is often the initial presentation of MS, and its occurrence can provide vital clues for early diagnosis. Understanding the relationship between optic neuritis and MS is crucial for predicting the risk of subsequent demyelinating events and initiating appropriate disease-modifying therapies. Neuroimaging biomarkers are invaluable tools for assessing disease activity, progression, and response to treatment in optic neuritis. With advances in neuroimaging techniques, various parameters, such as lesion volume, optic nerve atrophy, and magnetization transfer ratio, can be quantified and used as surrogate markers for disease severity and prognosis. Incorporating neuroimaging biomarkers into clinical trials and routine practice can help guide therapeutic interventions and improve patient outcomes. Neuroprotective strategies aim to limit axonal damage and promote repair mechanisms in optic neuritis. Several potential neuroprotective agents, such as antioxidants, anti-inflammatory agents, and neurotrophic factors, have shown promise in preclinical and early clinical trials. Protecting the axons from further damage and promoting their regeneration are essential goals in the management of optic neuritis, and ongoing research in this area may lead to novel therapeutic options. Visual field testing plays a vital role in assessing visual function and monitoring disease progression in optic neuritis. Various techniques, including automated perimetry and frequency doubling technology, are used to evaluate the extent and pattern of visual field defects. Understanding the correlation between visual field abnormalities and optic nerve pathology aids in determining the prognosis and guiding treatment decisions in patients with optic neuritis. Optic neuritis can occur in children as well, albeit less frequently than in adults. Pediatric optic neuritis shares many similarities with the adult form but also exhibits unique characteristics. Prompt recognition and evaluation of pediatric optic neuritis are essential, as it can be associated with various systemic conditions, such as demyelinating disorders, connective tissue diseases, and infections. Tailoring treatment approaches to the specific needs of children is crucial for optimizing outcomes and minimizing long-term sequelae. Growing evidence suggests that optic neuritis is not limited to the visual system but may also impact cognitive function. Cognitive dysfunction, particularly related to processing speed and memory, has been reported in patients with optic neuritis, even in the absence of clinically significant visual impairment. Understanding the complex interplay between optic neuritis and cognitive dysfunction is essential for comprehensive patient care and rehabilitation strategies. Optic neuritis can have a significant impact on an individual's quality of life, affecting daily activities, social interactions, and emotional well-being. Visual impairment, reduced contrast sensitivity, and color vision deficits can lead to functional limitations and emotional distress. Evaluating and addressing the psychosocial aspects of optic neuritis through multidisciplinary approaches, including rehabilitation and psychological support, can improve overall patient outcomes and quality of life. Optimal management of optic neuritis involves risk stratification and individualized treatment algorithms. Various factors, such as clinical presentation, imaging findings, and associated comorbidities, need to be considered when determining the need for immunomodulatory therapy and selecting the appropriate agents. Incorporating established guidelines and emerging evidence into clinical practice ensures appropriate risk assessment and treatment decisions, ultimately leading to improved outcomes in patients with optic neuritis. In conclusion, optic neuritis is a complex condition with diverse implications in neurology. Understanding the underlying mechanisms of inflammation, genetic factors, and advanced imaging techniques can aid in accurate diagnosis and provide insights into disease progression and response to treatment. The association with multiple sclerosis, pediatric considerations, cognitive dysfunction, and quality of life issues further emphasize the multidimensional impact of optic neuritis. By applying risk stratification and treatment algorithms, clinicians can tailor therapeutic interventions to each patient's specific needs, ultimately optimizing long-term outcomes. Further research and advancements in the field of optic neuritis are necessary to improve diagnostic accuracy, refine treatment strategies, and enhance patient care.